Hi, my name is Archita, and I'm going to be talking about the paper on cystic fibrosis. So, this paper had addressed how the use of technology could actually help with cystic fibrosis. CF gives a high burden when it comes to managing the disease and having to often attend clinics, and it gives you a higher risk of infection and a decline in health. So, in order to make sure that patients are well informed and actively engaged in their health, it is important to use CF care with the technology that could possibly assist with their condition. So a little bit of background about CF. It's one of the most fatal conditions in Northern Europe and affects over 10,000 people there. So it's basically a disease where patients struggle to clear their mucus, and they have recurring infections because of that. And they also have a lot of lung damage and decreasing their life expectancy. So it's important to maintain their health with self-care and attending hospitals. So the paper had addressed how technology could actually help with the maintenance of CF. There could be collaborative activity systems that could help link data between patients and clinical staff. And it could also improve the process of chronic care cycles and patients could use wearable technology in which patient data outside of clinics can increase. But this data is only useful if the patients and the clinicians talk about common goals.
Hello, my name is Eden. So collaborative activity systems, they generate data which require a shared sense making in order to play a role in clinical practice. So this depends on aligning perspectives between patients, clinical staff, and other caregivers to ensure proper care. And this process can improve if chronic care cycles are considered, as doctors can actively engage with patients' personal health information. So, an example is wearable technology, which has caused patient data to increase, but it's also useless if healthcare can't understand or use it. I learned that it's essential to explore how the factors of health conditions influence the organization of care and how technology can reshape this organization. So patients living with cystic fibrosis, they can further develop complications and they will need to self-manage themselves. So this becomes difficult to adhere to as the illnesses, they get more complex and patients need to make more frequent trips to the doctor. So external help like telehealth could alleviate stress on both parties because there's less burden of stigma from the public, it saves time, and it's efficient. So, studying technology and CF care can improve integration of external data from home based and wearable technology in healthcare. And it redistributes workload in the industry as there are now additional ways to provide care to the patient.
Result in cystic fibrosis care. So cystic fibrosis patients need to conduct a lot of self-care because of prescription cycling throughout the day, which involves waking up in the middle of the night and taking medicine during that time or taking medicine throughout the day at different times. A lack of proper treatment in facilities, which could be that the physical therapy that they're receiving is not enough for them to breathe better, or personal priorities, which could be jobs or families. In the use of external data greatly alleviates stress for these patients. And actually, the study mentioned that a couple patients felt that there was a potential of no longer being defined by cystic fibrosis. And a couple personal opinions about cystic fibrosis. I think that the integration of technology is actually really great, and it should be more focused on because it actually has a lot of potential for a lot of similar chronic illnesses. And cystic fibrosis has a lot of like self-care that the patient has to do by themselves. And the current trend of technology is actually leading towards like having a lot more self-care influence and like hospitals being like kind of a secondary unit. But the current foreseeable requirements that would be needed for this technology would be well integrated and grounded in patients' life, so that way patients don't feel like they have to do a secondary task and they feel like they're reliant on the actual system, and attendances to the nuances of collaborative working practices. So doctors, nurses, or any other specialists should be able to easily read through the documents and understand like what the symptoms of a possible illness that has come about because of cystic fibrosis is bearing.
Telehealth is defined as the delivery and facilitation of health and health-related services including medical care, provider and patient education, health information services, and self-care via telecommunications and digital communication technologies. Nowadays, more and more organizations are embracing telehealth. I think a powerful aspect of telehealth is improving access and the convenience of a lot of elements of healthcare. Also, remote analysis, monitoring services, and electronic data storage can significantly reduce healthcare service costs. The main limitation to adopt telehealth is patients' preference for face-to-face interaction. Other ones could be the lack of access to video-enabled devices such as smartphones or camera-equipped computers, the lack of confidence in the safety, security, and quality of virtual care, the lack of technical knowledge to connect with telehealth services, and finally, the lack of robust and reliable access to mobile data, cell service, and internet.
Telehealth is here to stay and people are generally accepting of it. Dr. Lau Berkowitz quotes, "Primary care doctors will be virtualists who are going to take care of hyper-convenient care, very scalably using virtual online technologies. Virtual health tracking will eventually force doctors to diagnose illnesses online and only the truly sick will be in hospitals, which will only be in ICUs. Some people still prefer face-to-face, but majority like the idea of telehealth."